Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. Treatment-resistant depression is a real problem for a group of people. It's when people don't get the relief that they need with typical medications and therapies. But there is a way to help that. We're talking with psychiatric mental health nurse practitioner Stacy Shepard about that today. Thanks for being here.
Thank you for having me.
This is a problem for a group of people. Tell me, what exactly is treatment-resistant depression?
So treatment-resistant major depressive disorder is when you have a moderate to severe type of depression that does not respond to conventional or traditional antidepressants or treatments.
And how are people diagnosed with this?
Typically, if you have tried and failed more than 2 antidepressant medications at particular therapeutic dosages for a period of time lasting 6 to 8 weeks, then you might have treatment-resistant depression. However, there are a couple of caveats here, and these are things that people don't often think about. So sometimes patients and even some providers don't understand the difference between treatment resistance or intolerance of medications. So I'm going to give you a couple of examples. I'm going to go with my good friend Zoloft, who's been around for a lot of years. So the minimum dose of Zoloft is 25 milligrams, which the maximum dose is 200. But in order to treat major depressive disorder effectively and therapeutically, it must be raised to at least 50 to 100 milligrams. So if I have a patient that comes in and I start them at 25 milligrams and they're on that for a few weeks and maybe they miss an appointment or something and we didn't get a chance to increase it to 50 or more. And it's been 6 to 8 weeks and they say, you know, Stacy, I've had absolutely no improvement. This medication is not going to work for me. Well, that's not considered a failure. So what we have to do next is increase it to a therapeutic dose. So then at that point, we would try the next best thing. And based on their symptoms, we would pick a medication that would hopefully be one that would bring them out of their depression. But if they go on to try to fail, they do fail these medications at therapeutic dosages or for long periods of time, and at least 2, then they can be considered treatment resistant.
So when you're diagnosed with it, what are some of the treatment options that are available when all of the others have failed you so far?
There are alternative treatments when medications have failed. So I'll go over a few of these. I will go over the ones that are the least invasive first. And so we'll start with TMS, which is transcranial magnetic stimulation, and this is usually done in an outpatient setting. A patient sits under a machine that has a magnet attached to it. It's very similar to like the coils within an MRI machine, and we hope to re-stimulate the neurons that way. And then next we have a medication called Spravato, esketamine, which is one of the newer treatments on the market, but this is a treatment that is also outpatient. It is a medication, but it does have to be in a controlled environment. And the results of this treatment have been very successful and impressive. Then next, we look at ECT. And so that stands for electroconvulsive therapy. In the old days, they called it shock therapy. We tend not to say that anymore.
Well, that's scary for people, but it can be super effective.
It can be. And our bodies are electric. You know, we run on electricity. And so this treatment is also electrical. But you do have to go to the hospital in order to receive this type of treatment. You may not have to stay overnight, but it's usually a full day being at the hospital. And what they do is they do send some electrical waves through to induce a seizure-like activity, hoping to reset those neurotransmitters, and hopefully then they will have some relief.
There are lots of different options available if you do come across treatment-resistant depression. You just need to start the conversation, and then step by step, your provider will help you through it.
Absolutely.
Stacy, thank you so much for being here.
Oh, thank you.
Thanks for checking in on Monday Health Minutes.